Guys, have you heard of fructose intolerance before? We would be looking at what fructose intolerance means, right? So sometimes do you have a meal or do you know someone who after eating fruits that are high in fructose, especially fruits, they begin to have so many symptoms, feeling very much unwell, feeling bloated, having headaches, having nausea, vomiting, they feel very much unwell after having fruits, that are very rich in fructose. They may actually be having fructose intolerance. Okay. And essentially, what fructose intolerance means is it's actually a situation where there is a problem in the way the body handles fructose, which is a simple sugar. Okay. And when it comes to simple sugars, you have glucose and you have fructose. And how the body handles fructose is dysfunctional. So when fructose is ingested, it gets into your stomach, gets into your small intestine, gets absorbed, is transported by your portal venous system to your liver. Okay, you can see the image of the liver. And when this fructose gets transported into your liver, it undergoes metabolism. And part of the metabolism, entails enzymes like fructokinase, fructose 1,6-bisphosphonate aldolase, which is called aldolase B. And you can see all the steps and processes that this fructose undergoes for it to be properly metabolized. However, if someone has a deficiency in aldolase B, which is this fructose 1,6-bisphosphonate aldolase, if this enzyme is deficient, what happens then is that this fructose 1 phosphate, okay, F1P, accumulates to a toxic level within your body, okay, within your liver and your blood. And fructose 1 phosphate accumulation is toxic. It can lead to, eventual damage of the liver, kidneys, and even your bowels. And this fructose 1 phosphate, by negative feedback, negative inhibition, inhibits glycolysis and also gluconeogenesis. And then that will lead to hypoglycemia. Okay. Because if you look at the pathway of fructose metabolism, you can see that fructose 1 phosphate can actually be converted to glucose 6 phosphate. And that glucose 6 phosphate can then be a raw material or a substrate for gluconeogenesis, for the production of glucose and also glycogen synthesis in the liver. Okay, and you can see that the fructose 1 phosphate can also be used as a substrate in the synthesis or the production of triglycerides, which are lipids. So you can see that fructose is also very useful for the generation of energy. Okay, so if you have toxic accumulation of fructose 1 phosphate, then you can have hypoglycemia and, of course, long-term toxic effects on your liver, kidneys, and your small intestine. So looking at this other slide here, we can see that, of course, fructose intolerance is an inborn error, okay, of metabolism of fructose, and it's due to deficiency of aldolase B, as we said earlier. But then looking at something that is similar to fructose intolerance but quite different is fructosuria, essential fructosuria, where you have excess fructose in the urine, okay, but really without really having those, very toxic effects of fructose 1 phosphate. Okay, so essential fructosuria is due to deficiency of the first enzyme, which is a rate-limiting step in fructose metabolism, which is fructokinase. So if you have deficiency in fructokinase, then you have essential fructosuria. But then if aldolase B deficient enzyme is deficient and you have toxic accumulation of fructose 1 phosphate, that's when you have the hereditary fructose intolerance that comes with the constellation of very distressing symptoms. So if you're experiencing this kind of symptoms, or you know someone who experiences symptoms when they eat foods that are rich in fructose, the advice is for them to speak with their primary care physician, speak with their doctor, and because usually the advice would be for them to see a dietitian, who would give them a strict plan on what they can safely eat and what they shouldn't eat, because they have to have a lifelong avoidance of foods that are rich in fructose. That's the treatment, essentially. Avoid anything that is rich in fructose. Your dietitian might actually advise you on some compromised things that may contain fructose, but in low amounts might also be well tolerated for your body. So speak with your primary care physician, who very likely refer you to have a dietitian review. Okay. And I wish you all the best. And if there's a medical student, who is doing the biochemistry, that is going through this video, feel free to come back and refresh, your knowledge on the pathophysiology of hereditary fructose intolerance and the pathway and enzymes that are involved in fructose metabolism. Thank you very much.